My name is Helen. I'm a nurse here at the Royal Brisbane and Women's Hospital. Today I'm going to show you where to go and what happens on the day you come in for your surgery and what you can expect during your admission here. The RBWH is located on the corner of Bowen Bridge Road and Butterfield Street at Hurston. There is a patient drop-off and pick-up zone at the front of the hospital, and on site there are several car parks, a taxi rank and major bus station. The closest train station is at Bowen Hills, a 15-minute walk away. Let me show you where you need to go when you first arrive. This is admissions. It's located on ground floor of the Ned Hanlon building, to the right of the front entrance. Please let the staff know when you have arrived. You will be asked to take a seat until your name is called. The staff will ask you to complete and sign some paperwork. It is extremely important that you check your personal details closely. Please let the admissions staff know if anything is incorrect prior to leaving this area. When directed by admissions staff, follow the green arrows to the lifts and up to the surgical daycare unit on level 4 of the Ned Hanlon building. When you arrive, please give your paperwork to the surgical daycare unit admin staff. You will be asked to take a seat until you are called through to the preparation area by the nursing staff. This will depend on what order you are on the theatre list. The theatre complex that the surgical daycare unit is attached to is a very busy place, and your patience is greatly appreciated during this waiting period. Nursing staff will bring you through to the patient change rooms, where you'll be asked to change into a surgical gown and underwear. You will then be allocated a recliner or a bed. After checking your personal details, you will be given an identification bracelet. This will be checked with you several times during your entire hospital admission. The nursing staff will then go through a list of questions. These questions will also be asked several times. All of this is to ensure that we make your admission as safe as possible. A set of observations will be taken, and stockings will be applied to help prevent blood clots. Personal belongings will be labelled with your name. Please bring only a minimal amount of luggage. It is also advisable to leave all valuables at home. To avoid being cancelled on the day of surgery, it is extremely important that you have followed all instructions given to you. This includes when to fast from, medications to stop, and anything you have been told to bring on the day of surgery, such as x-rays and CPAP machines. Any personal clinical equipment, such as a CPAP machine, must be checked by an electrician prior to your admission. If booked to go home on the same day as your surgery, you must have arranged an appropriate support person to pick you up from the hospital and stay with you overnight. We do understand that for many people, this will be an extremely anxious time. However, please be aware that access for relatives and visitors to the preparation area is restricted. Once ready for your surgery, we encourage you to stay with your support team in the surgical daycare unit reception room. Remember that you cannot eat or drink, and this includes chewing gum. As previously mentioned, the theatre complex is extremely busy and there may be extended waiting periods. The nursing staff will make every effort to ensure you remain comfortable and informed at all times. If you do have any questions or concerns during this time, please do not hesitate to ask. When you are called for your surgery, you will be taken through to an area where you will be placed on a trolley and transported to a room next to the theatre to prepare for your anaesthetic. When you are transferred into theatre, like this one, the staff will place monitoring equipment on you and may give you intravenous fluids. There will be quite a few people in the room working together as a team to ensure your safe patient care. During this time, your relatives are able to call or inquire at the surgical daycare unit reception regarding your progress in surgery and the ward you will be going to. Following your surgery, you will be transferred to recovery or the post-anaesthetic care unit. You will be monitored here for at least 2 hours, and when stable, you'll be transferred either to a ward or back to the day surgery unit if you are going home. Your relatives or friends are not allowed into this area. However, the nursing staff are more than happy to keep them updated about your progress. Going home following your surgery on the same day, you will be transferred from recovery back to the surgical daycare unit. In this area, the nursing staff will continue to monitor you, contact your support person and provide you with a light snack. You will be given a discharge education brochure which the nursing staff will read through with you and/or your support person. On the day of your discharge, you may be transferred to the transit lounge, located on the ground floor to the left of the front entrance. While you wait, you will be offered a comfortable chair to sit in and a tea or coffee. The transit lounge is staffed by nurses, so you know you're in safe hands until your support person arrives. The next day, you may be contacted by the nursing staff to inquire about your recovery and to answer any questions you may have. You will also be contacted after your discharge with your follow-up appointment details. If you are staying overnight, you may be admitted to the 23-hour unit. Nursing staff will aim to have you discharged by 9 a.m. the following day. You may not be reviewed by a medical officer prior to this, but will receive all of your discharge and follow-up information prior to leaving. If you're staying longer than one night following your surgery, you'll be transferred to a ward. Wards have a combination of 4-bed bays and single rooms. Single rooms are allocated to patients dependent on their clinical needs. Each bed area has a call bell if you need assistance. The ward nurses will help you with your post-operative needs and care for you while you recover. At changeover of shift, the nursing staff will hand over your current condition and care needs at your bedside. We strongly encourage you to participate in these conversations. Your family and friends may see you during visiting hours. Please check with each ward area to find out these times. You will notice hand sanitising gel throughout the hospital, and in particular when you enter a ward area, outside each room and by your bed. Hand hygiene is very important to keep everyone healthy, and we encourage staff, patients and visitors to regularly wash their hands. Your treating doctors will see you each morning, and depending on the type of surgery you've had, you may also need to see a physiotherapist, occupational therapist, a dietitian, speech pathologist or other healthcare professional during your admission. This is to ensure you remain safe both in hospital and when you are discharged home. Once you have recovered from your surgery and are well enough to go home, staff will provide you with information regarding your follow-up care and make sure that you have everything you need to make the transition from hospital to home an easy one. Hopefully I've provided you with an overview of what to expect when you come to the Royal Brisbane for your surgery. If you do have any questions about your surgery or recovery, please contact your care team on the information provided to you. Thank you for your time and we look forward to seeing you soon.